How y'all doing this evening? You'll be better when charity opens. We'll all be better when it reopens. Charity Hospital impacts every facet of life that goes on in the city of New Orleans, from the poorest to the richest. When somebody rich got hit by a stray bullet, I guarantee you they told the ambulance driver to bring them to Charity's trauma unit. Okay? When somebody poor got a cracked tooth and couldn't get a dentist because they couldn't afford them, they went to Charity where they had the dental clinic with the folks from LSU Dental. So it affects everybody in our community, and that's why I don't get along with a lot of folks who are just on one issue, because I said we have to fight for this whole community to come back as a whole, and not just let's rebuild Charity and the whole neighborhood around it goes to hell. We have to worry about building our whole infrastructure, rebuilding our whole city, and making sure people can afford to live here, can afford to be here in the city, and enjoy the same community and culture we had not even 5-10 years before the storm. I want to tell you about a meeting I had with LSU's Health Center director just in the Black Caucus just this Tuesday. He came in our meeting and they talked about how they were trying to recruit minorities in the dental school and how they were working with us, and introduced us to the new faculty, and he tried to sit down. I said, no, I need you to answer some questions. I need to find out what's going on with Charity. And I asked him, I said, well, what's going on? And the guy was like terrified. And I said, why are you so scared? He's like, well, we're all in the same boat now. And I said, really? I said, well, aren't you still getting all this money from the state? And I don't even think Charity's set up. Is that money coming back down to New Orleans to help folks out in New Orleans with health care, point of service care? And he didn't want to answer that question. So I said, well, do me a bigger favor. Why are you so afraid? Because normally LSU is usually at the head of every table, and when we try to do this consortium with the Cancer Center and stem cell research and the Charity Hospital, everybody's fighting over stuff, he said, to be very honest with you, we have a problem with our accreditation. Because now that there isn't a charity hospital set up, because there isn't a large-scale hospital, they can't recruit students because there are too many medical students per bed occupied by patients. So instead of having like a team of 6, he says like a team of 12, and their recruitment is going down because students want to come to an actual urgent care center and a clinic like Charity, as opposed to the private hospitals, which is where they're being redirected now. To me, the vision of Old Charity is when I got hit in a car accident in 1997 and I almost died, and actually thought I had died, and I went into shock. They took me, I got hit by a drunk driver Mardi Gras morning. I was out driving at 4 o'clock in the morning, trying to set up ice chest or something for Mardi Gras. And somebody came out of nowhere, a drunk driver, and just hit me, put me in a trauma unit in urgent care, and I almost died. And they took me right to Charity. I've never been in Charity other than, watch people's babies get delivered or whatnot. I'd never really been there. So I got to kind of see it when I was walking out, because they carried me in. And to me, my vision of Charity was, the place where the whole community could go, where if you had any problem, you had any kind of issue or nuance, you could go there to get assistance. It was everything, dental care, optometry, it was prenatal. I mean, I had never seen a hospital in any of the states that I visited that had that magnitude, that was that large, that was that much of a point of service. And actually, if you look at that part of downtown New Orleans, it was the core of the New Orleans downtown, that portion by Claiborne, because it feeds into the other clinics, and Delgado has a clinic, there's other ones like the Cancer Center, there's all these research and whatnot surrounding it. And then when you look even beyond the Old Charity, about 3 or 4 years prior to, actually 1 year prior to the storm, we passed a bill to make the biomedical district. So it actually, to me, became mentally the anchor for redevelopment research in New Orleans. We have an opportunity to really make history here in New Orleans and attract folks from all over the world to rebuild our city. I think if we start attracting folks instead of pushing people out, we could get closer to the days we used to have, as opposed to the ones we've been experiencing lately. So that was my old Charity. So then I had the discussion with the governor, which he finally gave me a meeting. We talked last week after several attempts on my behalf in the caucus. We finally got a meeting last week, and one of the big first issues we came up with was what was going to happen in Charity. And the governor kind of scares me. I don't know about y'all in this room, but he's a little scared of me. When he talks to you, he kind of talks through you. And he hasn't really had a good health record as far as I'm concerned. Just because you cut something don't mean it works because it cut. It just means it's no longer there, so it can't complain. So, it kind of scared me. And we sat there, we had a pleasant conversation. I just told somebody else, I was like, one of the best conversations I had it's like I just met Willy Wonka, and I got some candy, and it just made me feel all better, And I was like, man, this is a great conversation. But the thing with our discussion that bothered me was, when you talk to him, you got to kind of read in between the lines. And his vision on charity was, you know, that's a beautiful facility. We've got to figure out a way to bring that facility back to, you know, it can't be like assisted living facility, but it has to be something because it's too important to that area. It was never a discussion about being a hospital. It was, you know, it was what it can be other than a hospital. And then when we tried to challenge him on bringing it back as a hospital, he said, well, you know, it can't pass accreditation at this point now because of shared showers and the Privacy Acts, and because now they've been closed for so long, they're not grandfathered in to the new accreditation standards, so it would have to be a new hospital. So some of the Black Caucus folks in the room were like, well, we want our charity back, you know, we don't understand your vision, but we want our charity back. And they said, well, let's see what we can work on. But right now, my vision is a quasi-public-private entity. And my thing, whenever you say quasi-private, that means poor people ain't gonna get a bed. You know, that's, you know, that means poor folks ain't gonna get a bed.